Hi, everybody, and welcome to the webinar today, where we have 90 people registered, and we're just going to, more than 90 people registered, close to 100. So I'm just going to give a moment for everybody to arrive. I can see people starting to enter the room, so welcome. We're going to officially start in just a moment. We have close to 100 people registered, and then we'll get started in really just a couple of seconds. So it's your last chance to grab your cup of tea or coffee or your refreshment and sit comfortably, because we have a great session planned for you. I'll officially start it in just a couple of seconds. Welcome to those just arriving. Okay, so let's get started. My name is George Valiotis. I'm the Executive Director of the European Health Management Association, and I'm really pleased to be facilitating this beautiful session today for the EcoQUIP Plus project, which has been funded by the European Commission under the COSME program. The title of today's webinar is Innovation Procurement in Action, Launching of the EcoQUIP Plus Final Case Study-Based Report. And we're looking at outcomes of innovation procurement projects from hospitals across Europe. It's a 90-minute session today. And in a moment, I'll show you the agenda, but I want to talk to you about why this webinar is happening now and why it's so important. In this project, EcoQUIP Plus, we sought to address common challenges faced by healthcare institutions across Europe by adopting good practice innovation and sustainable procurement to demonstrate that the strategic use of procurement can improve the efficiency, quality, and sustainability of healthcare. What we want to do today in this concluding event is to launch the final publication. We're going to talk to you a lot about some of the details in that shortly, which involves 6 real-world case studies and their achievements. It'll look at their challenges, and we're going to share take-home messages from the project teams that hopefully you can find really helpful to guide your own work. Now, the case studies are from all across Europe, and they explore challenges across the whole spectrum of healthcare operations, from transforming the outpatient experience, again, but hopefully I'm still there. Okay.
Yes, I hear you, George.
Okay, apologies for that. I'm actually joining you remote from another location today, so I don't have the most reliable internet, but it looks like I'm back. So I was just giving you the summary and saying some of the things that we're looking at. And so that includes projects like transforming the outpatient experience, environmentally sustainable renovation of hospital wards, transforming waste management to support net zero and zero waste ambitions, and finding solutions to progressively move forwards towards zero waste operating theatres, also implementing smart emergency response systems, and personalizing orthopedic surgical processes. All of these case studies provide concrete examples of how innovation procurement can drive positive change. And certainly I myself at Emma, Emma's interested in health management widely, and I've learned so much about the role that innovation procurement can play in really changing the efficiency and the outcomes that we can have in healthcare systems. It's been quite impressive. And I think you'll see that in the case studies that are going to be presented today. They'll inform you, they'll inspire you, and they're going to offer valuable lessons and actionable insights for everyone who's a healthcare professional or a procurement specialist or a healthcare manager. Now we'll have, just looking at the agenda, if we can go to the next slide, you'll see after my welcome, I'm going to introduce a couple of other speakers who are going to talk to you about the EcoQUIP Plus methodology. We'll look at the case study presentations, and that'll be 6 10-minute sessions. And then after that, we're going to have questions and panel discussion. So that's your chance as an audience to ask anything you want to know. We want to make sure that this session today benefits you and your colleagues as widely as possible. So to start us off, I also just want to mention, this has been a 4.5-year project, and the work that you'll see presented has been amazing. And I just want to take the chance to mention health management and procurement happens in all sorts of challenges, and that included COVID. COVID made this project incredibly difficult because it was at a time, if you remember back when it really first hit us, where there was so much unknown and there was a huge amount of disruption. So I just want to give my acknowledgement to all the projects that had to overcome really quite extreme conditions. So let's just take note of that and appreciate the good work that they did to push through that. They will then focus on how they manage their projects in general, but I'll just give you that nod to say not just COVID, but there's always huge challenges in healthcare systems all the time. So well done to everybody for that great work. Now I'd like to take a moment to introduce Hervé Bouchard from the European Commission. Hervé, thanks for joining us today. It'd be great to hear your comments before we begin today's session.
Thank you. I don't know if you can see me. Let me try to put this camera on. I'm gonna start your video because the host has stopped it. Okay.
We'll activate your camera just now. It should take just a second.
Okay, very good. I let you do it this. Okay. Okay, I got it.
We don't see you yet. There you are. Welcome. Thanks for joining us.
All right, thank you very much, George. So welcome to everybody to this EcoQUIP conference, and Happy New Year also. We are still in this period, and I wish so everybody Happy New Year. It's maybe for some of you, it's the first conference of the year, so welcome. My name is Hervé Buscart. I work for the European Commission agency that is called EISMEA, which is the European Innovation for Small and Medium Enterprise Agency, which is responsible for the implementation of this project. I'm a project manager, so EcoQUIP is one of the projects that I follow. I'm super happy to be here in this final event to learn more about all the good work that has been done. So I will be with you during the whole conference. In the Commission, innovative procurement is what we call a hot topic. So we know it's a challenge to implement it, and we have been following this project with a lot of interest. And of course, we are very happy to be here and to listen to all the good work that has been done. Thank you very much. Looking forward for this conference. George, back to you.
Thank you very much, Hervé. Great for joining us, and it's wonderful that you'll be here for the whole session. And thanks for all your support of this very important project. Next, I'd like to have a look at the overview of the EcoQUIP Plus methodology. And for that, I'm going to introduce Gaynor Wiles, who has been really the powerful leader of this project. Gaynor, thanks for being here today and for your great leadership of this project.
Thank you very much, George. It's a pleasure to be here. I can't quite believe we're here at the end, but
yeah, indeed.
It's been fantastic, a fantastic group of people. So today I just wanted to give you a very quick overview of the EcoQUIP Plus innovation procurement methodology that we adopted. Next slide, please. Thank you. Sorry, for a moment I thought I was changing the slides. So central to EcoQUIP Plus and the focus actually of the final report that's being launched today was the development and implementation of 6 innovation procurement projects. As you'll see, the diverse set of projects, and each hospital partner identified and led in a challenge area of unmet need, where innovation was clearly required, and focusing on areas where they really needed innovation in order to enable the healthcare organization to fulfill their functions effectively and efficiently, to modernize, to reduce the environmental impact, and or to improve their services, and of course, importantly, to improve patient outcomes. Next slide, please. The projects were implemented as action learning projects. And what I mean by action learning is that this is an experiential learning and coaching approach, where each project team was supported to implement a live innovation procurement in their organizations in a way that maximized their learning as individuals and as teams and as organizations. Next slide, please. While each of the projects are unique, they followed the same good practice innovation procurement pathway, from defining the needs, building a wider market demand, and consulting the marketplace before then moving into implementing a pro-innovation tendering process. One of the key lessons from the prior EcoQUIP project was the importance of embedding an innovation procurement project within a decision-making structure of the organization, and from the start ensuring that key people were involved. And for this reason, all the project teams set up decision-making units, or DMUs, for each of the projects. And in those DMUs, you would find all the key people, all the internal stakeholders, people who needed to influence the project, decision makers, and of course the local facilitators. And our guiding principle of setting up the DMU was, is everybody who needs to be involved? And is there anybody who could say no that isn't involved, in which case we really need to get them on board. So the first step in the EcoQUIP process, step 1, asks the question, where are we now? So what we consider this is the discovery phase of the project, and it involved gathering information necessary to really understand in depth the current situation and determine really and prove why innovation was needed. Having thoroughly understood the current situation, the next step was to define what the new, you might consider it the ideal scenario, would look like. So where do we want to be? And this means thinking in terms of outcomes that the hospital needs to deliver, and what the new solutions really have to produce to change the situation. So moving from where we are now to where we want to be, improving hospital functions, improving patient outcomes. The conclusion of this stage, next, was the publication of and dissemination of a statement of demand. And the statement of demand was a really important tool to communicate the demand that had been identified to other potential buyers. And by reaching out to peer networks, the project teams could see if other hospitals really did share their unmet need, to get feedback from other potential buyers, and importantly, to get validation that they were on the right track. And this led to the publication of joint statements of demand, because what happened is in that communication process of the statement of demand, we got a huge amount of support. All the projects attracted the interests of other buyers, so enabling them to demonstrate a credible, wider demand to potential suppliers in the next and key stage of the entire process, open market consultation. So the open market consultations provided advance notice suppliers of the need for innovation and broke down barriers between the buyers and the suppliers. And it also importantly helped to determine the tendering strategy most likely to deliver the desired outcomes. Next. And next. And we adopted a 3-stage approach in our open market consultation, starting with market sounding, which was a written stage. So sending out, basically publishing the unmet need in a market sounding prospectus, gathering feedback from the market and really understanding what the market could offer, and also finding out about the barriers that market considered to being able to deliver the outcome, and how the organizations could really enable innovation in the tendering process. The next step was a consultation workshop, and we finished the process with bilateral meetings. And this is the first time that we'd adopted this 3-stage process. And I have to say, I think from now on, that would be our gold standard going forward. Next. Everyone was delighted with the response of the market, and this gave us confidence to move into the next stage, the pro-innovation tendering stage, which can often be the most challenging. And the idea of pro-innovation tendering is to conduct the tendering process in a way that gives the innovative solutions the opportunity to compete on a level playing field, and also importantly, to facilitate access by SMEs. So this is obviously a very quick overview, and more information about the tools and the methodology can be found in the final report. Next, please. And I'll conclude there, but now you'll hear a snapshot from each of the projects who really were, the local facilitators really were the stars of the show. Thanks very much. I'll hand back to George.
Thanks very much, Gaynor, for describing the methodology so clearly. There's so much to learn from, and this and more you can find in the report that's available on the website, on the EcoQUIP Plus website, which I'll point you to further again towards the end of the session. What we'd like to do now is spend the rest of this session looking at the next hour, looking at the 6 different case studies. So we're going to have 10 minutes from each case study, and we'll start with Tony Nadal from Park Taoli University Hospital, who's going to talk to us about personalized surgical process for joint replacements. Tony, thanks for joining us.
Hi, everybody.
Hi, you have 10 minutes. We'd love to hear about about your case study.
Okay, thank you.
Over to you.
Next slide, please. Okay. First of all, hi, my name is Tony Nadal, and I'm the coordinator of the 3D lab at the Park Taoli Hospital. First of all, I wanted to start by thanking EcoQUIP team for giving me the opportunity to be here and also for all the support obtained. Without them, this wouldn't have been possible. Today, I'm going to talk about personalized surgical process for the joint replacements project. This project started from the orthopedics unit within the Park Taoli Hospital, a hospital center with a large volume of surgical treatments. To develop the project, the 3D lab has coordinated with the Park Taoli Innovation Institute, ITRESPT, and AQUAS, a public entity with the mission to generate healthcare scientific and relevant knowledge to improve safety and sustainability. A big shout out to everyone who has participated in the project. It has been a long, hard work, but it has been worth it. So worth it, as you will see, that a little 3D printing lab has evolved to a new transversal unit for the hospital called digital surgery. Next slide, please. First of all, I will start by explaining the problem that was detected. Reparative surgeries are very complex since they not only require placing a prosthesis, but also removing the previous one that has failed. When the prosthesis is removed, the bone and the zip cones are much more damaged, making it more difficult to place the new prosthesis. It must be taken into account that currently the most common thing is to use standard prostheses that have certain pre-stabilized sizes. That is, in this traditional method, the patient must adapt to the existing prosthesis and not the other way around. We must also take into account the factor of placing the prosthesis freehand, which can generate small deviations. If the prosthesis must last from 15 to 20 years, having only a small difference, like millimeters, on the length of the result is going to cause great stress in the long term. Next slide. In prosthetic surgeries, the traditional method contains a series of details that make the process not optimal. On one hand, we must think that since it isn't known which prosthesis is going to be used, especially when it is a reintervention, the surgeon needs to bring all the tools and prosthesis sizes to the operation room, just in case he's going to need them. In the picture, you can see an example of a set of several boxes with the equipment for a surgery. But depending on the surgery, there can be more boxes. From a sterilization point of view, needing all the equipment means that you have to sterilize several boxes of surgical instruments each time, just in case. This means that a large amount of instruments are being sterilized, with the environment and resource impact that entails. Next. The starting point was to try to make 3D printed personalized prostheses. By making custom prostheses, we could reduce the amount of instruments to be sterilized and also adapt the prosthesis to the patient, reducing the possibility of reinterventions. Next. The first and most important thing from my point of view was planning the surgery. To do this, we need to create a digital twin and perform the surgery from the computer. This would allow us to reduce improvisation, take measurements, and have expectations about the results of the surgery. In the end, we wanted to simulate the surgery, but without having to be in an operation room. On the other hand, we needed to have access to manufacturing in a very agile way. If custom-made options take a long time to reach the hospital, this solution will not be applicable to many surgeries and, above all, will not be scalable. Creating health products means having to control and record all the processes carried out to comply with regulation. When it's something personalized, it is more important, since that piece is unique. Ensuring the traceability and the registration of all processes will be very useful to be able to have indicators to analyze and evaluate profitability. In the end, for this type of solutions to make sense, it must be able to be applied from a functional but also economic point of view. For this reason, we define the following needs to be met. We needed to personalize the surgery, but in such a way that it could be scaled up and become a new standard way of working. To do this, we must be agile, fast, and above all, safe, complying with all the necessary security measures. Next. Therefore, our requirement translates into moving from a traditional workflow to a customized one. Here you can see the traditional workflow where most of the decisions are made in the operation room itself. Next. For modifying the workflow, it was necessary to include several more phases in the surgical process. First of all, we needed to create a digital twin of the patient. Then we had to manufacture all the necessary instruments with all the regulatory, traceability, and registrations to finally obtain a kit or a closed solutions to carry out a personalized surgical process. In this way, when planning the surgery, we sought to bring the minimal possible instruments to the operation room to reduce the surgery use time as much as possible. Next. To continue this ambitious mission, we carried out a market consultation and listened to our stakeholders. To develop our project, we needed several industrial tools and solutions that were not initially intended to be applied in surgeries. This complicated the project since several parties had to agree and work together. Once all parties were heard and the real solution was analyzed, we were able to put out a tender for the project, which, at least for us, has required a lot of effort and work, much more than expected. We must also keep in mind that the idea was to go to the market in a very open way to be able to adapt and understand all the parts. This is theoretically very nice, but a lot of constant work. Next. In the end, as in all projects, not everything is as one imagines. Situations and things change, making you pivot. We finally saw that the best solution was to end up being manufacturers of health products ourselves. That was a paradigm shift, since by being the manufacturers, we could be much more agile and efficient. But on the other hand, the workload of records and process traceability increased significantly, really a lot. Another thing we learned is that there are manufacturing techniques that did not make sense to have inside the lab itself, such as 3D printing in metals. But we have seen that the applicability of surgical planning is so great that many of the interventions do not require personalized implant, but do require planning and surgical guides. Finally, we put out a tender that was a combination of equipment and software from different suppliers, medical and also industrial. The solution had to be integrated into the lab processes and work in harmony. Next. Therefore, we had to require all kinds of new tools. We are very happy to have been able to extrapolate this initial idea into a transversal project, not only designed for knee reintervention surgeries, but for all types of surgeries, whether or not they are reinterventional or knee surgeries. This approach has allowed us to understand the entire process much better and open our eyes to new applications. Personalized treatments are a reality and must be promoted to become a standard process. Now we are starting to compile the indicators to analyze the results, but we have already seen that we are much more versatile when it comes to making personalized cases, much more agile in manufacturing, and above all, more robust, safer, and faster in the regulatory area. Next. Here you can see the tools integrated in the 3D lab. Now we can simulate surgeries on the computer with engineering tools, but also maintaining the traceability and recording of all actions and processes in a much more efficient way. Also, an improvement has been incorporated in the communication system to coordinate planning with the doctor. In this way, we are much more efficient when designing a personal case, allowing us to make all types of surgical plans. We are also capable of manufacturing tools with biocompatible materials or 3D scanners to be able to digitalize in a non-invasive way. Next. In conclusion, we are very happy with the projection of the project and the applicability it's having. Many different profiles have agreed to be able to do this. We have created value in several aspects, and we have a solution with a very promising future. It's very important to highlight that the business ecosystem has also been improved. Several industrial companies have expanded their market by approaching the healthcare world. This is not only good for companies, but also for medicine, since it allows to expand the range of available solutions. A great indicator of the importance of this project is that now the 3D lab has become a medical unit. Just as there is a radiology unit, there is now a digital surgery unit in which interventions are planned and personalized health products are manufactured. It is still early to get definitive results, but by planning surgeries and working with personalized instruments, more precise surgical results are obtained. Interventions last less. There is more control of all processes and complications are reduced. This translates into a reduction in time in the operation room and a better use of resources, making us more sustainable and efficient. We believe that we are facing the new surgery, personalized treatments that are more efficient in results and use of resources. Next. I recommend reading the final report because there are much more details of our experience. Thank you all.
Thank you very much, Tony. That was absolutely fascinating. And I mean, you once hosted one of our EcoQUIP Plus meetings in your 3D lab, and we had the pleasure of seeing the amazing work you and your colleagues are doing. It was truly inspirational, and your presentation absolutely reflects that. I can see you've got a couple of questions waiting for you in the Q&A. And to the audience, I'd say, if you have any questions about Tony's presentation, if you're curious about the challenges, how the needs were identified, the innovative solutions he came up with, impacts that were made, lessons learned, key messages, any questions like that, do put them into the Q&A box, and speakers can type their responses to that as we go along. And we'll also have more opportunity once we get after these presentations, but do keep those questions coming. And thanks so much for those of you who've already started the Q&A. So let's move to the next speaker now. Next, we have Daniela Pedrini from the University Hospital of Bologna, Policlinico of Sant'Orsola. Thank you for joining us today, Daniela.
Thank you.
I'll hand over to you.
My name is Daniela Pedrini, and I am the coordinator of the Innovation Procurement Project at the University Hospital of Bologna. Next. The hospital is located on a large campus of around 23 hectares bordering the historical center of Bologna. It is a complex campus characterized by large green area with trees and has 31 separate buildings or pavilions, many of them providing outpatient care appointments numbering around 4 million per year. Access is by one of 16 entrances, mainly on foot, as private vehicle access is strictly limited. Next, please. Outpatient care constitutes a significant part of the clinical care provided at Sant'Orsola. However, many outpatients are elderly and with ambulatory and other limitations, and their navigation to the location of their appointment presents a significant challenge and stress. Clinicians also recognize that this affects the delivery of patient care and were frustrated about how often they need to repeat the test due to the state of anxiety of patients arriving at their appointment. Further research confirmed that this experience is felt more widely. For example, a study by the Royal College of Physicians found that the pensioners who attend an outpatient appointment reported feeling worse afterwards because of the stress involved in the journey alone. Lucien Engelen, CEO of Transform Health, speaking at CleanMed 2021, also highlighted the need for smooth outpatient journeys and stress-free experiences. Next, please. The aim of this project was therefore to transform the outpatient's journey, creating an easy pathway from appointments through the orientation and the wayfinding on the hospital site. In the discovery phase of the project, a range of different stakeholders were identified and consulted. These included patients and members of staff involved in outpatient services. The outcome of this discovery phase were confirmation that already ill or disabled patients frequently found the journey from home the day of appointments and then back home difficult to manage. And in some cases, patients were overwhelmed to the point that they may not attend, or they often arrive late or stressed to their appointments. Next, thank you. The requirement was defined as an innovative solution to enable the personalization and the optimization of the outpatient journey. 3 key outcomes were identified: to assure the timely arrival and attendance at the outpatient appointments, to enable a smooth and stress-free outpatient experience, to ensure that all patients have equal access to outpatient services regardless of age, disability, and other limiting factors. Next, thank you. Specific outcomes were identified, ensuring that outpatients arrive easily to the right place at the right time, access and smooth and stress-free journey, reducing number of the outpatients visits per patient, empowering patients to better manage their outpatient services, enabling equal access, adapting to changing needs. Next, please. The outcome-based requirement was then published in a statement of demand and communicated to peer networks, health authorities, and other healthcare providers with the aim of identifying those with similar needs. The response was very encouraging. They gained the support of 12 other healthcare organizations that confirmed they had a similar unmet need and who expressed interest to follow the Sant'Orsola experience. It enabled us to publish a joint statement of demand. The joint statement of demand attracted the attention of the regional health authority, who were keen to pilot and develop more digital solutions to support patients' care. It was agreed that Sant'Orsola would become a development partner, a pilot site for an app that would support some but not all of the outcomes that had been identified. This confirmation of support and wider recognition of the need gave the team and the DMU confidence to proceed to next stage of the project, open market consultation. Next, please. We launched the open market consultation to communicate our unmet need to the market and get feedback on the different options that could be available. We wanted to hear directly from the supply chain about their interest, capability, and capacity to offer solutions that meet our requirements. The market response demonstrated that there is a creative appetite for delivering solutions to meet the needs of Sant'Orsola within the time frame of the EcoQUIP Plus project. The market really embraced the challenge and were encouraged rather than discouraged by the innovative and challenging nature of demand. There was a clearly scope for innovation in the adoption of new and emerging technologies, the application of technologies to address new challenges, and the application and combining of existing technologies in an innovative way. Next, please. The valuable feedback from the market helped the project team to determine how best to approach the tender in a way that would mobilize innovation. A number of pro-innovation tender strategies were identified, while the choice of technology and models were impossible to select from the range of solutions available. We were clear on the outcomes needed for both the patients and the hospital. It was therefore logical to take a technology-neutral approach to the tender, using an outcome-based specification. Limiting the price criteria to 15% and taking into account strategic fit, quality, and implementation in the award criteria proved to be very motivating for suppliers, enabling them to differentiate their offering not on price alone. A value-based approach to monitoring and evaluating the first phase to create a firm base for demonstrating value and so support wider rollout. Working with the supplier to support ongoing innovation is already proving successful. Next, please. The final solution is a cloud and AI-enabled digital pathway providing a smart, integrated appointment management and a wayfinding solution for outpatients. A cloud-based platform provides a means to manage a complex network of data, including the regional booking system and electronic health records, which are integrated with 3 new patient-facing enabling technologies: the Easy Hospital app, an AI-based welcome and support virtual assistant avatar, and an physical totems where assistance and support can be accessed, and incorporating Bluetooth low energy beacons for indoor navigation and GPS for outdoor navigation. Together, this technology provides a seamless digital pathway for the whole outpatient journey. Most important things. Next, please. The project has had a real and lasting impact. While we and the management team are delighted with the technical outcome of the project, it has also stimulated a cultural change within the hospital and built an appreciation of how procurement can be used as an effective way to address problems and improve service provision. It has shown how we can redefine problems as unmet needs and use innovation procurement and to find answers rather than accepting the status quo. And it has demonstrated convincingly the innovation procurement can deliver real advantages, overcoming skepticism about new modes of working and creating a highly positive environment for its wider adoption to address future challenges. Finally, we would like to thank the EcoQUIP Plus team for their constant and valuable support and expertise, and without whom we could not have achieved these outcomes. Next, please. Thank you very much.
Great work, Daniela. Thank you so much for sharing that outstanding experience. Again, I'd encourage people to ask any questions in the Q&A and keep those questions coming, and we'll come back to more after the presentations. Daniela, thanks once again.
Thank you.
Let's move on to the next presentation, number 3. So I'll invite Indra Klimatavisian to come and talk to us about her really incredible project on smart emergency call and response solutions for hospitals. Indra, thanks for joining us today.
So thank you very much. I'm Indra Klementavicina, coordinating the implementation of EcoQUIP project here at Santaros Klinikos, and at the same time I'm head of innovation and technology transfer division here in the hospital. So next slide, please. Talking about the hospital, so we are the largest we are one of the largest hospitals in Lithuania, founded by Vilnius University and the Ministry of Healthcare in early 1980s. Our mission is to provide advanced and integrated healthcare for patients and develop and implement biomedical innovations. We are big. We are more than 6,500 employees, and we are tertiary level healthcare organization active in medical research, and also serving as training center. And also we can say that we are the leaders in health information and communication technologies and medical informatics. So next, please. So starting the EcoQUIP project, we discussed a lot about the problem, and our problem selected was identified by our anesthesiology and intensive care department. So despite the high quality of professional care provided here and professionals working in the hospital, life-threatening emergencies occur, and we found out that we need to which require rapid mobilization of and assistance of colleagues. So we needed the better management of these occurring emergency situations, which occurred in, let's say, situations such as complicated tracheal intubation, cardiac arrest, or severe bleeding, because the existing call and response system was not effective. It caused a lot of stress to our employees, staff, which trying to call for assistance, and the staff trying to respond to them. It also could have a risk, increase the risk of severe complications to patients as well. Was in such situation also because of very difficult layout of the hospital. As the hospital is big, it is operating in 19 hospital buildings in a huge territory of more than 170 square meters. So the current situation sometimes resulted that more specialists than needed reacted to the emergency situation, or sometimes we had also faced the situations when the assistance comes too late. So we definitely had to solve this, and therefore, next slide, please. We came up with that we need to install a smart emergency call and response solution that improves the management of life-threatening emergencies, leading to a better patient outcomes and staff experience. Next. So, discussing the requirements for the system, guiding, and we were guided by the expert of the EcoQUIP Plus team. We found out that we need a 24/7 alert pathway, working where the most appropriate medical specialist can arrive in the location of emergency. We also need the feedback mechanism on the call in order to reduce the stress for the staff calling for the help and manage the responses. And also we need data collection and analysis models working, because we are the learning organization, and we need to register these events. We want to analyze them and to learn for the future how we can improve the processes and better manage them. Next slide. So after discussing the needs, we prepared the statement of demand. We are happy that and communicated it, and we are happy that we attracted the support of other hospitals, other 5 hospitals, which also had the same problems, and it validated that our need was that, and made us confident that this is the situation we have to solve. Yes, and this joint statement of demand was published and promoted and in preparation of for open market consultations, and helped us a lot. Next. So then after joint statement of demand publishing, we ended the open market consultations phase. And actually, I have to say that it was extremely rare in Lithuania at the time due to prevailing control culture of public procurement. We were more used to apply the formal communication with the suppliers and the market, and so it was really a new format, a new approach to hospital as well, applied for the first time. So we were very careful to ensure adherence to public procurement regulations when entering and implementing this open market consultation. Next. So we developed market communication documents to communicate our unmet need effectively to the market. Prepared outcome-based requirements and published it as market sounding prospectus and PIN in national and international platforms of public procurement tenders. So it was, and what we found out that it was not only new for us, it was also new to Lithuanian market. And it was not only we who were more used to formal presentation of market communication. It was, yes, it was really new to the suppliers as well. So yes, this market was launched in June 2021. It was accompanied by the questionnaire where we tried to gather feedback, and we also had market consultation event and bilateral meetings and the feedback questionnaire again. Next slide, please. After open market consultation, I want to look into the results and responses we received. So we are happy to receive 12 responses from the companies representing 6 countries. And it was also a good representation of SMEs. So the market confirmed that our solution was possible within the timeframe of a project to implement. We also received multiple ideas and different ideas, even from the view we imagined how solution could be, how the problem could be solved, and we're happy to receive that. So the solutions were unknown. Some of them were known to the project team. And we found out that suppliers were keen to have more detailed technical specifications. So of course, it's not surprising because the culture of public procurement is more formal in Lithuania. So they were more comfortable with detailed technical specifications. And we had to be creative and have to think how we should balance this need for innovation and the detailness, for technical detailness they requested to us. So we decided to draft the hybrid specification detailing outcomes and functional requirements. Yes, to emphasize this vital to ensure compatibility with the internal IT systems. And also from open market consultation, we identified that within the team we need more IT competences, and we need to make changes in the team. Yes, to broaden the composition of the team. So the market engagement process provided to be a very important and useful and eye-opening step in preparation for the tendering process to the team, to the organization, and it demonstrated the value of active communication and openness with suppliers and benefits to provide advance notice to the market to allow it and to provide time to prepare for delivering the solution. And it was also important in building confidence in our team and validating the requirements and potential solutions. So working with the EcoQUIP market engagement process gave us the perspective of how more informal and more proactive approach can benefit the procurement process. And we already applied this approach in other new projects. As example is like modernization of laboratory infrastructure. So we learned this lesson thanks to EcoQUIP Plus project. Next slide, please. So after open market consultation, we entered the pro-innovation procurement phase. And actually, it took time to us to reflect on the findings of the consultation and to translate them into procurement approach. So as I mentioned, we had to balance the need for technical guidelines and leave enough space for innovation. So we decided, so it was difficult to decide choose the procurement method and the procedure we should proceed with. To ensure and to get the best solution to manage this crucial and critical clinical service provision. We concluded that further discussions will be needed with the suppliers, so between suppliers and internal stakeholders. Yes, that we need to make sure that the solution will meet our requirements, and therefore we decided to select the competitive dialogue procedure, even though it takes much longer than other procedures in time. So it is the first time when Santaros Klinikos adopt competitive dialogue. It's also one of the first time in Lithuania when competitive dialogue is used for the purpose to enable innovation, because most of the time it is used for the complicated procurement, but not related to the innovation, innovative solutions. Next, please.
Thank you very much, Indra. I'm just going to jump in to say where you're 3 minutes over time. So if I could ask you to start to wrap up. Thank you so much.
Okay. Yes. So we, as I already mentioned, we agreed to include both functional and non-functional requirements. We balanced award criteria and we tried to remove the barriers for SMEs to participate in the tender, applying very light pre-qualification criteria and less demanding financial guarantees and insurances, avoiding it. Yes, please, next slide. The tender of Smart Emergency Call and Response Solution was launched in November 2023 on local and European tender portals. And we are following all the steps of competitive dialogue. Currently, the tender is still in process, and we are looking forward to receive the bids to be submitted until mid-January. So as we follow this process, we are reasonably confident that we will receive the solutions, and yes, we expect to. We are looking forward to. Next, please. So this process, it was incredibly learning experience for our organization and the team. What I want to share with you that it was the required organizational change, and the changes requires time. And also this new approach, not only time consuming this change, but also very important, in the situations where financial decisions are required is support from both staff and senior management. So also that mapping all stakeholders and involvement of them, all the stakeholders from the beginning is very critical to success. We face staff turnover, and yes, it affects the process definitely and can result in delays. So it's important to manage that, and it's very important when you do the things for the first time, the external expertise. So we are happy that we had this EcoQUIP Plus project assistance and external expertise we could learn from, and which assisted us in this process. So thank you very much. And the final slide, next slide. So yes, innovation procurement we currently run is made for the first time for our organization, and it's really very challenging because in Lithuania as well, the guidelines and methodological information on how to run and how to handle procurement of innovation were launched only in January 2023. However, now we have a confidence that we can proceed with that, and we'll definitely do innovative procurement later on. And Lithuania has very ambitious goals that innovative procurement would be like 20% of all procurement by 2030. So now we can see that thanks to EcoQUIP project, we can add up to achieve these national goals we have. So thank you very much.
Thank you very much, Indra, and really fantastic goals that you've set as a result of this project. That's really impressive, a lot to learn from. I can see there's lots more questions coming up in the Q&A, and I'd encourage people, some of our previous speakers like Daniela, I think there's a question waiting there for you. There's more questions to answer there. So do speakers keep your eyes open, and audience, I'd encourage you to also keep your questions coming, especially following Indra. Your presentation was great. There's so much innovation happening there, so many organizational challenges that you've overcome, new practices, new things. If people have questions about how you go about doing that, or if you have anything comparable, we'd love to hear from that. Let's move now to the next presentation, please. So I'd like to introduce Sam Willits now, who's the Head of Sustainability from Bristol, North Somerset and South Gloucestershire Integrated Care Board. Sam, thank you for joining us today.
Hi, thanks. So I'm going to talk about our project towards zero waste operating theatres. Next. So we're a big hospital precinct in the west of England, in the centre of Bristol. It's a large group of hospitals with about 13,000 staff that serve around 500,000 people. And we're part of the National Health System, which became the world's first health service to commit to reaching carbon net zero. But the trust itself wants to be a real leader in sustainable healthcare, and is even more ambitious and has set a 2030 net zero carbon target. We want to lead our community in improving the environment, tackling air quality, and the use of single-use plastics. Next. So let's dig into the problem a little bit of what we're facing with. Our operating theatres are the most resource-intensive area of our hospitals, using lots of energy and lots of single-use items. 30% of the waste generated in operating theatres, and much of that is in our theatres, and much of that is single-use plastics. So we've got a big problem, and it's definitely the area to focus on is in our theatres. And we recognise that what we really need is to take a different model of how we use those resources. So how do we become zero waste operating theatres? Next. And we understood the problem. It took us a while to think through exactly what our aim was. We narrowed it down to drive the transition to circular solutions and reduce the single-use plastics in operating theatres, with the ambition to move progressively towards zero waste operating theatres. Next. we went into the discovery phase and identified our stakeholders, but the engagement side of it wasn't so straightforward. It's definitely a bit of a challenge. We looked into analysing our purchasing data, which gave us the scope, which turned out to be very broad. When you think about an operating theatre, there are hundreds, if not thousands, of different products. We looked to do waste audits, but that was delayed considerably due to the pandemic. There were a lot of other priorities at that time. The really key part of the discovery phase was our staff are the most valuable source of information and ideas. Next. So focusing on what our actual requirement was, we looked at the products and services that we would need to support us getting into a zero waste operating theatres. We knew we wanted to reduce the amount of single-use items, the packaging, and the carbon emissions from producing them. We wanted that any remaining packaging to be 100% reusable, recyclable, or compostable. And really where we want to get to is transitioning to a circular material flow and multiple use items rather than single-use items. And we need to make it easy for people to make the right green choice in their purchasing. And we need to find a way to bridge the gap between our policy and what actually gets purchased. Next. So we entered into consultation with NHS England nationally and Healthcare Without Harm Europe, who helped us get the wider picture from across Europe, and they helped us to refine our requirements. And a statement of demand was published and widely communicated. That statement of demand had loads of interest and support from a wide range of NHS hospitals and other organisations. The feedback we received helped us refine that into a joint statement of demand, which ended up with more than 20 organisations supporting it, the initiative, and that shared the same unmet needs. Next. So knowing that there was a demand for this unmet need, we went to the market to consult them. This was a really interesting, exciting phase. It was intentionally a really broad approach to enable the team to find out what was possible, what could the market do. We wanted to hear directly from the supply chain about what their interests were, capability, and the capacity to offer solutions that met our requirements and overcome the challenges we faced. I'm really pleased we had a really great response. We got returns from a wide spectrum of sectors, and out of the 30 responses received, 60% of them were from SMEs. Next. So the market gave us really useful feedback on the different options that were already available or could become available. And we found out about some existing solutions which were already available, such as reusable textiles. We learned that addressing the problems with medical packaging was a really complex issue which had global and systemic changes to deal with. And the really broad remit of the project helped to engage a wide range of the supply chain. However, we realized we needed a narrower focus to actively stimulate innovation in particular areas. For example, the specialist reusable theatre drapes. Now, waste management was a really key theme in the market feedback. And this led to the Trust initiating a second innovation procurement project, which I'll come on to after this one. Next. So the complexity of the problem of getting to zero waste theatres meant there were a lot of different areas for us to act on. We've got several of them shown here. That we, from our market insights, we created an action plan with lots of different actions, different fronts that we need to tackle. Some of the things we knew we could do straight away, such as eliminating unnecessary use of single-use plastics, such as gloves. Other areas, such as the packaging, and getting toward moving to circular material flows required a much bigger discussion and action at a larger scale, working nationally and digging much more into the supply chain. Next. One of the opportunities we took forward for the market engagement was working with suppliers of remanufactured surgical devices and making procurement choices in favor of using them. We're already from that work seeing significant cost savings and reductions in carbon emissions. You can read more about this one in the case study. Next. So in conclusion, well, we've achieved considerable learning from going through this innovation procurement process, definitely influencing our approach to innovation and future procurements. This project has led to significant organizational change. We've established a formal decision-making pathway for sustainability, social value, and carbon saving projects that goes beyond the zero waste theatres. We've also established a trust governance route that enables business cases for zero waste projects so they can get approval and be taken forward. And most importantly, it's really given us the tools to bring in innovation to projects and address our future procurement challenges, such as in areas like catering and laundry. Okay, next. Thank you. So I think I'm going to jump straight into the next one, George.
Sam, I will just jump in for a second. I want to thank
sure.
you very much for that first presentation, which was great. You will be presenting one more for us now. I'm just jumping in to say there's lots of Q&A coming in. I'm really happy to see just how many questions the audience have. To the panelists, I'd say you can always go back to the Q&A, and there's an open tab for questions that are open, and there's also an answered tab for questions that are answered. And some of the questions that are answered, you might have something else to add to it. And I think people from the audience can also reply to some of the answers. So do keep your eye on the answer tab, and to the panelists, I'd ask you to keep visiting that as well. So keep them going. We will, we've got 2 more presentations before we go to the broader Q&A, but just a nod towards that. Otherwise, Sam, I invite you back again to give us the next very interesting presentation. Back to you.
Thank you. Thanks. Yeah, so our very broad approach to the Zero Waste Theatres project brought into focus the need for a radical look at the way the Trust approached waste management. And to facilitate that transition to a circular economy, we really needed to look at how we segregate, collect, and treat the waste we produce. With the current waste management contract arrangements for coming to an end, it was a real opportunity for us to further adopt the innovation procurement methodology to help us achieve that shift with the establishment of this new project to deliver sustainable waste management. And next. So this procurement opportunity was also the moment to extend the project to cover 2 big hospital trusts in the Bristol area, essentially doubling the size of the project. We're very aligned across the 2 trusts in terms of our sustainability targets, and we're working closely together. So it was a really good opportunity to increase the size. Next. And we'd been contracting through a national procurement framework, which we'd used for many years, and was had been just sort of continually being renewed, but it really wasn't meeting our national carbon reduction targets or the Trust's really ambitious sustainability targets. So we knew we needed to do something different. Also, historically, the waste management supply chain has been very resistant to innovation and been dominated by a small number of very large suppliers who really control the market. So we worked together across the trusts to really define our shared unmet need, which we worked out was we need to transform our healthcare waste services towards progressively more environmentally sustainable waste management and reduction services in support of the Trust's sustainability and net zero targets. Next. And we set out our aim, which was to transform our waste management services to reduce that volume of waste generated, reduce the carbon emissions to net zero, and enable the change to a circular economy in a transparent way. Next. So we identified the problems with the existing approach. There's lots of waste going to landfill. Waste was being transported long distances. There was a lack of monitoring and transparency. We didn't really know what was going on with the waste. And that paying for the disposal of waste by volume really doesn't incentivize reducing volumes or circularity. In fact, it encourages bigger volumes. The poor segregation of waste, particularly the clinical and recyclable waste, have a really high environmental and financial costs by getting into the wrong waste streams. Next. So understanding those problems really helped us think about what the outcomes were that we were looking to achieve. We wanted to reduce waste volumes, improving segregation of waste, achieving zero waste to landfill and zero waste exported to other countries, absolutely minimizing incineration but beyond what we had to do for compliance, and reducing the transport of wastes. Next slide. So we produced a joint statement of demand, which we shared with other hospital trusts in the UK and Healthcare Without Harm for to get views across Europe. It was a really great process, and it was very clear from that sharing that statement of demand that there was a real consensus that there was a need for change in the waste management services. And it really showed that there was a strong demand and a need for change. Next slide. We went into the market consultation phase, which was really good. We got 30 responses, of which 60% were the SMEs. The information we got out of this was absolutely invaluable. Really opened up our eyes as to what was possible. The market did have solutions that could contribute to achieving our outcomes of what we wanted. And also, it did reveal that the NHS procurement processes that we traditionally used really limited new solutions and innovation and stopped SMEs from competing in tenders. And next. And so what did it tell us? Well, it told us that we couldn't do everything on day one. You know, we had some real ambitious things, and that it would take time, that we'd need to have progressive improvements over the term of the contract. We learned that the length of the contract was important in how it could support innovation and investment. We learned about what SMEs could offer and the challenges they face, particularly in accessing tendering process. We learnt where suppliers could help with our net zero target most, and also where they really were less able to help. And we explored the challenge of actually specifying waste reduction within the tender, and how that could be a challenge for some of the suppliers. Next. So our pro-innovation procurement steps, actually getting a agreed procurement strategy was quite a difficult step, but this really did lead to lasting change, including a new requirement within our trusts for procurement projects to have an agreed procurement strategy, which is a really significant change in how our organization has worked. That not taking the easy route of just going to national frameworks was a big shift for our purchasing teams, doing things really differently, and applying the insights we gained from the market feedback and the need for innovation, that had to be balanced with other concerns and perceived risks. So there was a lot of delicate exercise we had to go through for this step. Next. So we're adopting a pro-innovation approaches meant we were definitely doing things really differently. We're taking a outcomes-based approach and embedding sustainability, carbon and waste reduction, improving air quality into the tender documents and through the whole process. And using award criteria that had balancing the price with operational and sustainability outcomes. So these approaches were a real significant change, but we've learned a huge amount, and we're now applying those approaches and principles in other procurement exercises. Next. There were lots of challenges along the way. Here are some of them. But I think, yeah, a really big one is introducing new ways of working. Certainly is hard in large and complex operationally critical services. And also the challenge of having a pricing methodology that incentivizes waste reduction. We haven't managed to achieve that yet, but we have managed to get build a way of having progressive improvement through collaborative contract management that's been built into the tender. So we've learned a way to do it without completely shifting things. Next. One of the strategic decisions that came out of the market engagement process was the opportunity to make an immediate transition to reusable sharps bins. So we will no longer be sending plastic bins with needles to be incinerated. To implement this, it hasn't been simple. We've had to get our clinical staff and our infection control teams to support this new approach to a way of working. But it's going to give us significant benefits in reducing the single-use plastics and carbon emissions. To achieve 48,000 plastic bins being saved, a 30% reduction in waste, and an 88% reduction in carbon. So a really significant impact. Next. So despite the challenges, the tender is in progress for sustainable waste management services across both trusts. And we are in the midst of it at the moment, evaluating the responses. And it's really interesting to see what the market is coming back with. That pro-innovation approach has resulted in sustainability being embedded throughout the tender documents, the evaluation criteria, the key performance indicators, and really importantly, the contract management mechanisms. There's the commitments that the suppliers are making in those tender responses will form part of the net zero and social value management plan for the contract. And that's being converted into the commitments with it, which we'll be able to monitor through the contract. Next. So, in conclusion, the pro-innovation procurement approach has enabled the trusts to challenge the status quo and take really positive steps towards a more transparent, sustainable, and lower carbon waste management solutions and service delivery. The learning that we've had made in this project has had a real impact, including on the national picture. We know that it's influencing other waste tenders and frameworks that have learnt from our experience. And it's had a lasting impact in changing procurement processes, including that requirement to have an agreed procurement strategy, and the importance of market engagement, particularly with SMEs, taking a much more prominent role. There's been an increased awareness of how procurement can be used to achieve our strategic objectives and better outcomes, rather than simply being reduced to a financial transaction. So we are really making steps towards that, achieving carbon reduction and circularity. And it's set us on that journey towards zero waste, net zero carbon waste management, and achieving the Trust's ambitious commitments. And importantly, it's really empowered the sustainability team with the knowledge of pro-innovation approaches, enabling them to challenge the status quo of procurement. So we're really starting to close that gap between policy and procurement action. And I want to really thank the EcoQUIP team for this transformation that's been for me and for my wider team. Thank you.
Thank you very much, Sam. That was absolutely fascinating, and especially to hear about the way that innovation procurement is helping you to challenge the status quo and really push forward on these innovations. Such a great example. Again, I'd encourage people in the audience, if you have Q&A, please keep using the Q&A box as you've been doing. We have one last case presentation to show today. And if I can have the next slide, please. So I invite Martin Kauch from Suka Beskida Hospital in Poland. Martin, thank you so much for joining us.
Oh, thank you. But I'm just wondering that since we have something like 8 minutes, whether we should just do that or we should just, have the panel discussion.
Well, I think we'll be okay with the panel discussion. There's been lots of Q&A. How about you just take us through maybe some of the key points of your presentation? It'd be great to hear maybe at least just the framework. If you could just take maybe 5 minutes, would that be okay?
Well, let's see then. Could I have the next slide, please?
Thank you, Martin.
Right, so the Sucha Beskidzka Hospital is located in Poland and south of Poland. This is slightly bigger than an average hospital in Poland. Here we have some data. As we are running out of time, I'm not going to spend time on that. Next slide, please. Can I have the next slide? Hello? Thank you. So our project was very heavily dependent on the need. So we were trying to understand what really is needed. We knew that we need to do the renovation of the hospital, the renovation of ward by ward. Though we wanted to make sure that this is just any renovation as in the past, but it is very much dependent on what people actually wanted from us. And we did that first of all, so our internal meeting, but then we also consulted the patients, consulted the staff. We have lots of consultation also outside of the hospitals. We did a survey that you can see here on the right. So all in all, I would say that we spent quite enormous amount of time on understanding what we should be doing. And I think that that was very innovative, because usually when you do the renovation, you just simply say, okay, we need to have it black, or we need to have it lighter, or we need to purchase something. And in this case, we're first of all trying to understand what we really need. Next slide, please. Right, we wanted to the renovation not to be just as any other. We wanted to make sure that there's minimal disruption in what we'll be experiencing, that this is economically efficient, that it will be sustainable, it will be future-proof, and that was what we were trying to incorporate in all our activities. Next slide, please. Right. We, of course, as everybody prepared the statement of demand, and in the statement of demand, we focused on the issues that you can see here first, and the most important case was temperature and quality of air, then conditions in patient room, sanitary facilities, lighting, communication. This was the thing that we wanted to improve in this renovated ward. Next one, please. We also wanted to make sure that this is not just what we think, and this is just, we are so unique, so we need to do that. So we consulted with actually every single hospital, the county hospitals in the province of Małopolska where we're located. And everybody that we talked to, and there were also some hospitals outside of our voivodeship, that yes, you're right. When you prepare the statement of demand, we can also sign that we share your need, and we think that what you're doing is also then to be replicable and done in other hospitals. Next one, please. We had quite an also intensive market consultation, but I would say intensive in the circumstances that we are in, and I think that we also have a similar case like in Lithuania. So the central and eastern part of Europe is very is quite different to the other parts. That we have a very heavy and intensive control all the time. So we are a bit afraid of not passing the line or just doing something that would be then punished. So let's say for what we could expect, we were pretty pleased with the number of companies that got interested, with the meetings that we had with them. Actually, when you thought that you were done, the Business Finland is an institution that is trying to export Finland's know-how and business worldwide. That could we have another meeting, because there are some Finnish companies that want to share their offers to what you're doing. So we had something like an extra time, and we have this one. Next one, please. Right, and the solution is that we came up with is maybe not something that is like I don't know, the Great Chinese Wall or Eiffel Tower. So you don't expect to see something that is very much different to what you would usually see. But we were able to include small scale changes, small scale innovation. And all in all, I think that by putting all the small pieces together, we were able to make a change that is quite a big one. Next one, please. Yeah, here you can see the list of things that were done much different to that usually would be done. And if you combine them together, there's something that doesn't really happen in Poland. And you can see the pictures here of the renovated wall. Next one, please. Yeah, another one. So just pictures. Let us have another one. Right, and I think what is really important, I think that if I was to stress something, and as George asked me to do the highlights, I would say that two things were important. First of all, it was learning. So we learned about the need, and we spent a lot of time on learning what we are supposed to do. And it was like, entering the huge palace, the huge castle. So you're opening the door, you learn something, you can see another door, so you open them, there's a wow, there's another big room and another information. And it was like opening another door. So this was one important thing for us. We learned a lot. And the second is that I think that we can talk about some sort of the project offset. So because of we contacted so many people all over Europe, we were able to get in touch with different companies, institutions, that we hope that will be very profitable for us, because we made this network. We can now apply for new funds, new money, new ideas. So I think that it was really something that wouldn't have happened if we were not doing this the way we did. Thank you very much.
Thank you very much, Marcin. That was really absolutely fascinating. I'm glad we got to hear from your example as well. That is us for time. I want to thank everybody so much for being here today. If we could just drop the slides, and if I could ask all the panelists to activate their cameras, just so that the attendees can really get a final look at the brilliant people who did this amazing work. I mean, it really highlights just how amazing innovation procurement is. It's incredible what it can achieve. I feel like when I reflect back over the years that we've been doing this project, nothing is the same. You've given us a whole new way of looking at solutions, and you've given us new processes. And for people who might not have had a chance to answer their question, I'd really encourage you to go and look at the report. It's on the EcoQUIP Plus website, and there's a lot, all the details have been presented are already there, as is lots more. And I want to really thank all of our speakers and panelists today. I'm applauding you. I'm sure that people in the audience are also applauding you. You've done such incredible work yourselves, your colleagues, and all the people who've been involved in this journey. So I just wanted to take a moment to thank you so much, and wish you all the best. And I look forward to whatever happens next. So just to conclude, I also want to say really a special thanks to Hayley Welsh from Optimat, who coordinated the EcoQUIP Plus project and has really led on this, putting this report together as well. Obviously, Gaynor Wiles from Jarrah Consulting, who has been our inspiration, our guide in this work. Gaynor, really the way that you've coached us to think differently about innovation procurement is really special. And I think the audience will also see that in the report, the way you've helped all of us, all of the different hospitals and all of us here tell the stories of innovation procurement and think about the different skills is quite exciting. And that is all shown in the report. So Gaynor, thank you for that. And I also want to thank the EMA, the European Health Management team, who've been instrumental also in making today happen. So Dina and Marina and Cesar, our graphic designer, and Olga for your management of the team, including me, to getting this done. Thank you so much for making this look, not just look pretty, but be accessible to people, and making sure that the reports are developed in a way that are great to access. So that's all we have time for today. And I just want to quickly hand to Gaynor. Gaynor, do you have a final word you'd like to say?
Really just obviously, thanks so much to European Commission and the COSME programme for giving us this great opportunity, and for sticking with us through some, remembering that we started this in January 2020. So it's been a fascinating journey, and just congratulations to everyone on the whole team. It's been brilliant, and you've all been great. Thanks very much.
Absolutely. Thanks again. I think I forgot one of my colleagues, Elisa, and probably many more. So if I didn't mention anyone, thanks to everybody. And don't forget, check out the EcoQUIP Plus website, and also the social media. There's a lot on the Twitter channel that you can follow there. Thank you. Take care, and see us in that report. Take good care, everyone. Goodbye.
Thank you very much, George. Thank you, everybody.
Thanks to the audience for all their comments and questions. It's been great to be here with you. Take care and goodbye.
Bye-bye.